Okay, second video. So the other thing I didn't mention or didn't elaborate on is the house training issues. So Smokey has been house trained his whole life. And there was some regression, which I know is going to be really scary to see with your adult dog who's never had this problem. You're just thinking what does it mean? Is it, it's that serious? And it's, so for Smokey, it wasn't that he didn't lose control. He can still decide when he pees. And it wasn't that he couldn't make it outside, because he's in the garage on the rug, lining himself up and peeing on purpose on this rug in the garage. So I think what it is more is that, first of all, it's just frustrating that he keeps having to go or keeps feeling like he has to go. And so going outside over and over and over is annoying. Also, maybe he knows it's only a small amount of pee that's going to come out. So it's not going to get all over his feet if he pees on the rug. And there's also, I think, just a habit aspect where once they've done it for a couple days, they keep doing it. So even though I know you don't really care about cleaning up pee right now because you're so worried about your dog, I actually do recommend kind of staying on top of this, and not in a mean way, but just when you see them, if you see them peeing in the house, just pick them up and put them outside. And I do say when I catch him, that's technically not positive training, so I totally understand if someone wouldn't want to do that, but you can still just pick them up and take them outside, and then most importantly, praise them and give them a treat every time they go potty outside. Smokey has always really liked going to the bathroom in sand from the time I got him. So we got a few bags of play sand from Home Depot and just put them kind of right outside their dog door, so it was really accessible, and to see if that would encourage him to pee outside. But again, mostly it kept me busy. It gave me something to do that felt productive, which was just really important for me psychologically. I also got these cheap motion sensor chimes off of Amazon just to tell me they have to go through two dog doors. They have to go through one to get into the garage and another to get outside. So I got two of them so I could know when he was going into the garage and when he was going outside. But wherever your dog, if there's a spot your dog keeps peeing, or if there's just a situation like that, these might be really helpful, and I'll show you them real quick. Okay, so this one is called Bistee, Bistee, and you can see the title there. So these work surprisingly well. They don't seem like they would for so cheap. The only thing I recommend is raising it, instead of sitting it directly on the ground, depending on the height of your dog, set it up on something so that the sensor there is at the height of your dog's torso, so it's catching the bulk of your dog, and then they work really well. So for my dogs are really little and low to the ground, so I just have it sitting on a single brick, but depending on your dog, you might want it a little higher. And then I set them to two different ringtones. So we hear a bing bong when they enter the garage, and then we hear Waltz of the Flowers from the Nutcracker when they go all the way out. So it's just really helpful in not making us get up and run after him over and over and over. And then I put a little thing of treats next to my chair, just so that anytime he goes outside and pees, I can give him a treat. Lived by Holly, courageously protecting the house from probably nothing. Gonna help her, Bradley? Yeah, it's nothing, huh? Okay, thank you. Okay, so next let me get to all the stuff at the oncologist. So first we did a dry run. We had a couple days before we got the appointment. And so the day or 2 days before the appointment I had some time, so I just drove them up there. And we just walked around the parking lot and ate treats. And they actually had a 24-hour lobby at ours, so we walked in, and the lady behind the counter gave him a dog treat, and so it just assuaged my anxiety. Smokey is a third home rescue dog, and he's kind of reactive. He usually takes a sedative to go to the vet in general, so I was pretty anxious, and I was really anxious about whether he would behave well enough for the oncologist to do everything he needed to do, which seemed really important. That didn't really turn out to be a thing. There wasn't much of a physical exam, and they I think they put all dogs under for both the, I think it's an initial CT and then an MRI that they use to guide the radiation, but they put the dogs under for all that anyway. So him being kind of crazy wasn't a huge problem, but their office did say that I could give him his normal trazodone and gabapentin that he takes as a sedative before the vet, and that it wouldn't interfere with anything they were giving him. The only thing he couldn't do is eat for 8 hours ahead. For that reason, they don't want them throwing up when they're like under anesthesia or coming out of anesthesia, because some dogs get nauseous from it, but constant access to water is okay. And I didn't need to give a second urine sample at the oncologist, just for the BRAF at the internal medicine guy. Okay, so basically Smokey's treatment plan is the piroxicam that the internal medicine doctor had prescribed, and he's on 3 milligrams as an 11.5 kilogram dog, just in case anybody's curious to figure out the mgs per kg or anything. So, okay, so we went to the oncologist, and I had like a lot of questions. One of them was whether it was the bladder nodule or the prostate tumor, which, by the way, isn't necessarily considered a metastasis. The doctor did mention that he can't tell whether it's all one tumor or even whether it's the same kind of cancer in both spots, but he said since it wouldn't affect treatment, it's not that important to know. But anyway, like, I was wondering whether the prostate tumor or the bladder nodule was what was causing his urinary symptoms, and the doctor said his best guess is that the prostate tumor was causing his urinary symptoms. And I also asked him whether the fact that Smokey has transitional cell carcinoma and not adenocarcinoma means that the tumor actually originated in the bladder and spread to the prostate. And he said it doesn't necessarily mean that. He said there are some transition cells, I think between the urethra and the prostate or something like that. So it may well have originated in the prostate. And okay, so he said, and this is probably controversial, but I'm just going to say what he said, that so this doctor, and the reason he's recommended to us is that he's both a medical oncologist and a radiation oncologist, which is typically two different things. A medical oncologist does chemo and a radiation oncologist does radiation. And so this doctor is both, and I honestly didn't do my own research on doctors. The internal medicine doctor just said make an appointment with this guy, and I did it, but he seems to really know his stuff. So he said he has not found chemo to work very well for this treatment for prostate cancer, and I don't know whether that recommendation is any different for what people call prostate cancer, adenocarcinoma, versus what Smokey has, which is the TCC, transitional cell carcinoma. But he said at least for what Smokey has, he doesn't recommend chemo. He said there are some people who come in and they're like, we want to do everything possible, and then they do radiation and chemo, and he said that's fine. He said it's not wrong to do chemo, but he just hasn't seen outcomes as good. And the other nice thing about radiation is that the side effects are not crazy. It may depend on the specific radiation machine that the doctor's using, and I'm going to show just a couple screen grabs of like what my doctor's using in case it tells you anything, but he did say that it was like a very good machine. So he said they can target really specifically, but that they will treat Smokey's whole bladder because TCC is so likely to metastasize, and there could be like small, I don't know the term, but cancer seeds that like we can't see. So he's going to treat the whole bladder as well as the prostate. And I asked him to just check one of Smokey's back legs because Smokey keeps biting at it, and I was like, I just want to make sure there's not like metastasis there. And he said that they would check his whole hind end in, again, I believe it was an original CT, and then that the photon therapy, the radiation is guided by MRI, but I'm not 100% clear on that. So Smokey is going to get 5 doses, 1 per day, and the way they do it at his oncologist office is either Monday through Friday or Wednesday, Thursday, Friday, Monday, Tuesday. They don't work on the weekends. And we had the option to start during Thanksgiving week, but it would have resulted in an extra break because they won't see us on Thanksgiving. which made me a little nervous. So I opted to start the following week, and I guess the Monday start must have been full because we're starting on the Wednesday after Thanksgiving. So he'll do the Wednesday, Thursday, Friday, Monday, Tuesday. I did ask the doctor if he had noticed any difference in outcome with like the split Monday, Tuesday, Wednesday, or the Monday, Tuesday, Wednesday, Thursday, Friday all in a row versus starting Wednesday and having to take the weekend off. And he said no. I don't know for sure, but 1 dose per day for 5 days is Smokey's treatment plan. And he'll be there 4 to 6 hours the first day and about 3 hours each day after that. And they said that he can't eat before it because, again, they are like knocked out for this, which honestly is a relief to me so that I know he won't freak out and like mess it up. But we can bring his breakfast and they'll feed it to him as soon as he's like awake enough to have it. And then, and the other, just an aside, when we got Smokey's BRAF, it also said there was protein in his urine. And I asked the doctor if that meant something else was going on. He said, no, it's a function of the cancer. It doesn't mean anything. So if you see protein in your dog's urine, that's just part of the whole cancer constellation. And then one other thing he mentioned that I would have wanted to know is you can only do the radiation twice. So he said the response varies, and this will likely shrink the tumor. It will not get rid of the tumor. So he said that the duration before like needing it again is typically, and I think they just go based on symptoms. So when your dog's symptoms return, then you would do your second chance. He said was somewhere between 4 months and 1.5 years, that it really just depends on the dog. I assume, that you have probably a better result if you find the tumor before the dogs have any symptoms versus, in Smokey's case, he's kind of moderately symptomatic, but not like totally sick and horrible, but definitely having urinary symptoms. So, it kind of will be what it will be there. So once every day for 5 days, he said the side effects are not that bad. He said a lot of dogs get diarrhea starting on day 10 if day 1 is the first treatment. But he said it's usually kind of like a 3 out of 10 severity. So I think it's usually treated with metronidazole, just, like as an add-on treatment for symptoms if the dogs need it, but that a lot of dogs don't need it. So if I remember, I'm going to try to ask them to just give me some so I can have it on hand because Smokey is kind of prone to diarrhea. He's half Frenchy, and so I might just ask for that. But he said the side effects are not crazy, and I think part of that is that the doses are designed like almost everybody walks in and says, "Hey, I'll try it, but I don't want to make my dog miserable." And I think the doses are designed as as a palliative treatment, like as it's not going to cure your dog, but it may improve their quality of life and like give you more good months. So I think both radiation and chemo for dogs are kind of designed not to make the dog super miserable. Of course, some dogs have like a worse response than other dogs, but generally it's not like what you're picturing that a human cancer patient may go through with like throwing up and losing all their hair and just being like really, really miserable. I was very worried about that, and it seems like that is not like as much of a concern with dogs. I also want to mention I asked him about supplements, and so he basically said there are none with such good data that he really recommends them to people, but that he's not against them, and he just asks that like I clear it with him to make sure it's not going to interact with anything. And what he said specifically, and this surprised me because antioxidants are anti-cancer, right? But he said don't give like extra doses of vitamin C or E or like any antioxidants because the way the radiation works is by oxidizing the cancer to kill it. So I think those are all good things to give like when your dog is totally done radiation and chemo. Well, I don't know about chemo, you'd have to ask, but when your dog is totally done radiation, but during radiation, you don't want that. So I'm giving him the melatonin. He said that's fine. He wasn't too familiar with the research saying it works. Like he didn't sound as sold on it as as I am, but it won't do any harm. And then I decided not to give Smokey the apple caps until which is another supplement I was considering is the apple caps, which don't have double-blind clinical randomized data or anything, but were developed by a vet and just seemed like something I might want to try, but I will not give that to him during radiation because it has extra vitamin C. So I may try that like after he's done with the radiation. So supplement wise, and I also asked him, is there a diet you recommend? Because I had read some things and he said that he does recommend low carb. So for Smokey, that's going to be a little tricky because he's had pancreatitis twice, including recently, that like developed when I put him on a higher fat food and went away when I put him on a lower fat food. So reducing carbs typically means increasing fat, and I need to make sure I don't like cause him GI symptoms. But I have a plan, I think. Like we do homemade nutritionally complete food, which is probably not something you're going to want to take on right now if you're dealing with all this, because there's a ton of vitamins and minerals, and like I did a whole like course and I use a spreadsheet and stuff. So but like if your dog eats kibble, you can find some lower carb, higher protein options. My doctor recommended 30 to 40% protein, dry matter basis, and then just keeping carbs to a minimum. And also carbs with a lower glycemic index are better than carbs with a higher glycemic index. So something like white rice will spike the blood sugar, and cancer needs I don't remember if it's glucose but it needs like carbohydrate as a fuel source. So if your blood sugar is high, it feeds the cancer. If your blood sugar is lower and steadier, it doesn't feed the cancer as much. So if your dog needs to stay on carbs, then maybe choose like a whole grain carb, or like vegetable carbs, rather than like white rice or something like that. So yeah, treatment wise, and we actually we were at the oncologist for like a long time yesterday. We wanted to go ahead and get the initial scan, like the CT scan, as quickly as possible, because the doctor needs the CT scan and needs a few days to make a treatment plan before he can actually start. So we did that right away, so that was like several hours, and then they said the first visit 4 to 6 hours and the subsequent visits 3 hours. And the cost, so this his initial scan was like $1,500. His radiation is around $5,000, so really high cost. We do expect our veterinary insurance to cover like about 90% of it. There are some things they don't cover, like the actual exam fee and stuff can be a few $100s, but like that's the gist. So I think this guy, I'm assuming, is way on the upper end of like what radiation would typically cost, because he's got this, Lamborghini fancy radiation machine, and I know they have like a whole facility where people come from like hours away and board their dogs to get this treatment. So he seems to kind of be a big deal. So I'm not sure it will cost $5,000 for everyone. But that was the cost for us, and so we decided to go ahead with that. And then I'll just mention one more medical detail just in case people are interested. So typically when Smokey has to be like knocked out at the vet for them to do a more invasive procedure that he can't tolerate, they've used TORP, I think. And I was kind of like, wow, he's so groggy after it. Like he's going to get that every day for 5 days. It's going to be a really rough 5 days for him. But the vet did say they used different and hopefully better stuff for to knock him out for the cancer treatment. So he said it's like a doggy Valium. He said midazolam and propofol, and that they will get a throat tube with 100% oxygen. And he said not only is that like a safety thing to protect the airway, but also the really high oxygen helps the radiation work somehow, like because the radiation works by oxidizing the cancer cells to death. More oxygen is better. So they do that, and so I'm guessing his throat will probably be really sore by the end of 5 days of that. But overall, it sounded a lot less like side effects, a lot less scary and overwhelming than I expected. Is it almost time for the things? Yeah, I know you know. You know too, huh?